to be here among the clinical research industry players at this conference. And I've been hearing exciting news, and to be truthful, I've been following this news about the progress of and the recent developments of sponsored clinical research in Malaysia. This is especially with the record-breaking performance achieved last year, in which sponsored clinical research has generated a cumulative gross national income of 1.16 billion ringgit since 2012. Now, the establishment of Clinical Research Malaysia, or CRM, to drive and catalyze the industry in Malaysia has proven to be a successful strategic initiative by the Ministry of Health. Now, what is immensely astounding is the fact that CRM has been self-sufficient financially for the last 6 years, and while doing so, is significantly and positively impacting the country's clinical research landscape. Shall we give them a big round of applause? And I would like to especially commend the whole team at CRM for driving clinical research as a value-based industry, in addition to bringing in invaluable foreign direct investment and catalyzing local ones as well. Now, this landscape further supports the downstream growth in this country, especially in enabling domestic production of pharmaceuticals. The potential investment in our human capital, expansion of industry capacity, economic and financial gains from increased exports, as well as Malaysia's advancement in the global value chain is indeed immense and significant. We are already observing the rippling effect from the growth of the clinical research industry, with multinational pharmaceuticals and contract research organizations, CROs, growing their presence in Malaysia, thus making this country as the hub in the region. The global clinical trial market was valued at over $80 billion in 2023, with a projected growth of 6.5% annually. Half of this is now very much committed within the Asia-Pacific region, especially in China, South Korea, Japan and Australia. Now, this would, of course, is in fact reflects of the importance, and I truly believe that Southeast Asian nation, by way of, in comparison to the East Asia, in comparison to South Asia, Southeast Asian nations are in fact the sleeping giant. And I would want to believe that they are a sleeping giant because it is one of the most diverse locations with skilled workforce and supportive infrastructure. And we are one of the Southeast Asian nations. As genomic-led precision medicine is poised to transform modern healthcare around the world, Asia, and I would want to believe Southeast Asia, which includes, of course, Southeast Asia, holds immense potential for the adoption of precision medicine, riding on such a unique genetic diversity. As the clinical research industry grows, supporting services such as the CROs, the laboratories, manufacturing plants, and logistics services will see expansions as well. This is where more skilled workforce is created to support the industry's need. We have already observed this in Perak, Malaysia, where its data management centers were set up, PGS Lama, to support the region. Additionally, we have the establishment of Immunogenic, a central oncology laboratory, with Malaysia being one of only 4 global locations of their footprint, has contributed to the employment of scientists and bioinformatics skills and personnel in the country. The socio-economic value brought about by clinical research is impactful, with over 2,700 skilled jobs recorded in the clinical research field last year. Not just job, but high-paying job. that which will get us out of our middle income trap for decades now. Today, we have over 26,000 participants in Malaysia that have taken part in various global clinical trials. Given their central and critical role to the process, in conjunction with the celebration of Clinical Trials Day this month, I would like to acknowledge their role in contributing to medical advancement. I would also like to convey my gratitude to investigators of clinical trials whose commitment and perseverance has ensured the quality delivery of studies. Many are acknowledged as top and first recruiters globally and regionally. Their excellent contribution has placed Malaysia in the global clinical trial map. A monumental achievement can only be built on a solid foundation, which is the clinical trial community, and we can do so only with the spirit of humanity, stability, and sustainability, as alluded by the CEO of CRM earlier. So how do we progress further? I cannot overemphasize the importance of staying competitive and evolving with the global developments. We should seize opportunities, endeavor to advance reforms, and remove barriers to clinical research. This must be reflected in the ease of doing business of repeated words of the Right Honourable Prime Minister to us in the Cabinet, always reminding us to ensure to achieve ease of doing business. By improving timelines, by cutting down unnecessary bureaucratic processes while maintaining our quality and standards. That is critical. Investment opportunities for clinical research industry must be facilitated. As they are abound, they must be facilitated, and regulations and policies updated to remain relevant to the current market needs or to fulfill unmet needs of the industry. The Malaysian government truly recognizes the value proposition of making this country a global clinical trial hub, as well as its qualitative contribution to healthcare. However, much is to be done for this region to flourish and to remain an attractive destination. I hope this conference would spark discussion and ideas on how we could enable all this. I take this opportunity to again express my gratitude to all that have contributed to this ecosystem, including the sponsors, of course, especially the industrial players, healthcare professionals, and the clinical trials participants.